All right, welcome everyone to another deep dive.
Yeah?
This time we're going to be looking at the latest 2025 Standards of Care in Diabetes from the American Diabetes Association.
Hot off the presses.
They are. They just came out.
Yeah.
So those of you who follow along with these standards know that they come out every year.
Every year.
And they are the gold standard, I would say, for healthcare professionals in terms of taking care of folks with diabetes.
Yeah, they're really the go-to resource.
Yeah, and there's so much new research and new technology that's coming out all the time that I think it's so helpful to have an organization like the ADA put it all together in a nice, concise package for us.
Yeah, it can definitely be overwhelming to try and stay on top of everything, that's for sure.
Great, so we're going to try to do that for you in this deep dive. We're going to go through some of the highlights, and hopefully by the end of it, you'll be up to date on all the latest and greatest in terms of diabetes care.
Absolutely. Looking forward to it.
So one of the things that jumped out at me right away in reading through these standards is just the emphasis on person-first language.
Yeah.
Moving away from terms like diabetic patient and using person with diabetes instead.
Yeah, I think it's great. It's really putting the focus on the individual and not defining them by their condition, which is super important.
Right, and it creates a more respectful and empowering environment, I think, for everyone involved.
Absolutely. It aligns with that patient-centered care model that we've been talking about more and more. So
Right.
it's a good shift.
Yeah. Another thing I noticed right off the bat is just how many different organizations are endorsing different sections of these standards. I mean, we've got the American Society for Bone and Mineral Research weighing in on bone health. We've got the Obesity Society contributing to weight management. The American College of Cardiology is involved in the cardiovascular stuff.
Yep, all the big players.
And even the American Geriatric Society is now a part of it this year. They weren't last year, were they?
No, that's a new addition this year. Yeah, they're focusing specifically on older adults with diabetes.
Right. And so it really shows you that taking care of diabetes is not just about, checking your blood sugar. It's about, looking at all these different aspects of a person's health and well-being.
Exactly. It's a multifaceted approach.
Right. So let's dive into section 1 here. This is improving care and promoting health in populations.
Okay.
And one thing that I found really interesting is that they're not just focusing on, people with diabetes, but they're also talking about people who are at risk for diabetes.
Yeah, prevention is key.
Yeah, so it seems like they're really emphasizing prevention this year.
Absolutely. And they're diving into different care models like patient-centered medical homes and accountable care organizations, which really focus on coordinating care and providing more comprehensive support.
Right, so it's not just about what happens in the doctor's office. It's about creating a whole system that helps people stay healthy.
Yeah, it's about supporting people in a more holistic way.
Yeah.
Looking at all the different factors that affect their health.
Yeah. They're also talking a lot about interprofessional teams, breaking down those silos between different healthcare providers and making sure that everyone's working together.
Yeah, teamwork makes the dream work.
Right. Because in the past, it's been, like you go to your primary care doctor for one thing, and then you go to your endocrinologist for something else, and then you go to your, dietitian for something else.
Right, and no one's talking to each other.
Right, and nobody's talking to each other. And so this is really trying to, I think, bring all those people together so that you have a more coordinated care plan.
Exactly, a more unified approach to care.
Right. And then another thing that they're really emphasizing is health equity.
Right, that's huge.
Making sure that everyone has access to the same quality of care, regardless of their background or their circumstances.
Absolutely. They're really looking at the social determinants of health, like access to healthy food, transportation, and how those factors play a role in managing diabetes.
Right. They even cite research that shows that food insecurity is linked to poorer diabetes control and higher healthcare costs. So addressing those social factors is really important.
Yeah, it's about recognizing that health is not just about individual choices, but also about the environment and the systems that people are living in.
Right, exactly. Okay, so moving on to section 2, diagnosis and classification of diabetes.
Okay.
They are now talking about the complexities of diagnosing people who have characteristics of both type 1 and type 2 diabetes.
Right, because it's not always clear-cut, is it?
No, it's not. And I think that this is really helpful for healthcare providers to have this guidance so that they can make sure that they're making the right diagnosis and putting people on the right treatment plan.
Yeah, because the treatment approaches can be quite different depending on the type of diabetes.
Exactly. And then there's some exciting new stuff in this section, too. like guidance on antibody-based screening for pre-symptomatic type 1 diabetes.
Oh, yeah, that's a game changer.
Yeah, so potentially catching it before people even develop symptoms.
Exactly. That's the goal.
Right.
Early intervention can make a huge difference.
Right. And then for those who are pregnant or planning to become pregnant, there's a completely revamped section on gestational diabetes mellitus, which is obviously really important.
Yes, very important for both mom and baby.
Right. So those are some of the highlights from Section 2. Now moving on to Section 3.
Okay.
This is prevention or delay of type 1 and type 2 diabetes.
The all-important prevention.
Yeah. And of course, they talk about the usual things like diet and exercise.
Of course.
But I was surprised to see that they're now talking about sleep
Oh, yeah.
as a factor in preventing type 2 diabetes.
It's about time.
Right. Because we know that sleep deprivation can really mess with your hormones and make it harder to regulate blood sugar.
Absolutely.
Yeah.
And the research is very clear on the link between sleep and diabetes risk.
Right. They also provide updated guidance on vitamin D supplementation and long-term metformin use for prevention.
Yes. So looking at both lifestyle and pharmaceutical interventions.
Right. And then there's a strengthened recommendation for teplizumab, which is a medication that can delay the onset of symptomatic type 1 diabetes.
Oh, interesting.
So a lot of exciting new developments in the world of prevention.
Yeah, some promising options for people at risk.
Yeah. All right, so moving on to Section 4.
Okay.
This is comprehensive medical evaluation and assessment of comorbidities.
The whole person approach.
Yeah, so this is really about looking at the big picture, not just focusing on blood sugar, but understanding how diabetes might be impacting other aspects of a person's health.
Right. It's about looking for potential complications and addressing them early on.
Exactly. And one of the things that surprised me in this section is that they have a whole new subsection on dental care.
Oh, really?
Yeah.
I guess it makes sense, though.
Yeah, I guess it does, because a lot of people don't realize that oral health is actually really closely linked to diabetes.
It is. There's a definite connection between gum disease and blood sugar control.
Right. So they're emphasizing the importance of regular dental checkups and good oral hygiene.
Yes, and also making sure there's good communication between your medical team and your dental team.
Right. So it's all connected, right?
It is, definitely.
Yeah. All right. So that's a wrap for Section 4. We've covered a lot of ground already, from diagnosis to prevention to a comprehensive medical evaluation. But now let's talk about what individuals can do to take charge of their health.
Okay, sounds good.
So Section 5 is all about facilitating positive health behaviors and well-being to improve health outcomes.
Empowering the individual.
Yeah, exactly. And a big part of that is diabetes self-management education and support, or DSMES.
Right. Education and support are crucial.
Yeah. And they're actually recommending now that everyone diagnosed with diabetes should participate in DSMAS.
Everyone, not just those who are struggling.
Right. It's not just for people who are having trouble managing their diabetes. It's for everyone.
Interesting. So it's more of a proactive approach rather than a reactive one.
Yeah, exactly.
I like that.
Yeah. And they're also emphasizing that DSMAS should be personalized, tailored to the individual's needs, preferences, and cultural background.
Makes sense. One size doesn't fit all.
Right. They're also talking about ongoing assessment to track progress and adjust goals as needed.
So it's not just a one-time thing. It's an ongoing process.
Right. It's about providing ongoing support and helping people develop the skills they need to manage their diabetes effectively.
And they're also recommending integrating behavioral health screening into DSMES, which is important.
Yeah, because we know that mental health plays a big role in how well people manage their diabetes.
Absolutely. It's all connected.
Right. So I think it's really great that they're highlighting the importance of mental and emotional well-being in these standards.
Yeah, it's a holistic approach to care.
Right. All right, so we've covered a lot of ground already in this deep dive. We've talked about diagnosis, prevention, comprehensive medical evaluation, and the importance of self-management, education, and support.
Yeah, we're making good progress.
But we're not done yet. In the next part, we'll be tackling those sometimes dreaded topics of food and medication.
Okay. Looking forward to it.
So stay tuned for more exciting insights from the 2025 Standards of Care in Diabetes. All right, welcome back to our deep dive into the 2025 Standards of Care in Diabetes.
Back for more.
We are. So we're now going to tackle those topics that everyone loves to talk about, food and medication.
The bread and butter of diabetes care.
Right. But, before we get into the specifics of, what to eat and what medications to take, I think it's important to remember that this is all about finding what works for you.
Absolutely. Personalized care.
Right. There's no one-size-fits-all approach to diabetes management.
Nope, not at all.
And so I think these standards do a really good job of emphasizing that.
Yeah, they really do.
So let's dive into section 6 here. This is medical nutrition therapy.
Okay.
And one of the things that I was really happy to see is that they're moving away from these really restrictive diets, and they're focusing more on just finding an eating pattern that works for you.
Yeah, ditch the diets, right?
Yeah, exactly. So no more like, counting calories and grams of fat and all that stuff. It's really about just finding foods that you enjoy and that fit into your lifestyle.
And they help you manage your blood sugar.
Right. Exactly.
Yeah, so it's about making healthy choices, but also being realistic and sustainable.
Right, because if you're not enjoying what you're eating, you're not going to stick with it.
Exactly. It has to be something you can live with long term.
Right. They do provide some specific guidance, though, on certain things.
Oh, yeah.
Like they talk about limiting processed foods.
Of course, the usual suspects.
Right. And they also emphasize choosing lean protein sources and exploring non-dairy alternatives.
So kind of a plant-forward approach.
Yeah, I guess you could say that. But again, it's really about finding what works for you.
Right. It's about having options.
Right. One thing I was curious about is that, these days there's a lot of talk about keto and intermittent fasting.
Yeah, those are hot topics right now.
Yeah, and I was wondering if the standards address those at all.
They do. They do. They acknowledge the growing interest in these approaches, but they also emphasize the need for individualized assessment and guidance from a registered dietitian.
So not a blanket endorsement or rejection, but more like a proceed with caution kind of thing.
Yeah, I think that's a fair way to put it. They also talk about religious fasting, like during Ramadan, and provide specific recommendations for people with diabetes who observe those practices.
Okay, so they're really trying to be inclusive of all different lifestyles and beliefs.
Absolutely.
Yeah.
It's about meeting people where they're at and providing culturally sensitive care.
Right. Okay, so we've talked about food. Now let's move on to exercise.
All right, let's get moving.
So section 7 is all about physical activity and exercise.
Got to stay active.
We do. And again, I think they do a really good job of emphasizing that it doesn't have to be, this super intense workout every day.
Yeah, no need to be a gym rat.
Right. It's really about just finding ways to move your body that you enjoy and that fit into your life.
Right. Even small changes can make a big difference.
Exactly. They do talk about reducing sedentary time, though, which is something that I think we all struggle with these days.
Oh, tell me about it. All that screen time.
Right. But even just standing up for a few minutes every hour can make a difference.
Yeah. Just got to keep moving.
Yeah. They also provide specific guidance for people who are on weight management medications or who have had metabolic surgery.
Okay, so tailoring recommendations to different situations.
Right, because their exercise needs might be different.
Makes sense.
Yeah. Okay, now for the fun part. Section 8, diabetes technology.
Ooh, the gadgets and gizmos.
I know, I'm excited about this one. So there are a lot of updates in this section, but one of the biggest things that jumped out at me is that they're now encouraging earlier adoption of technology.
Really?
Yeah.
So not just for people with advanced diabetes.
Right. It used to be that, technology was kind of reserved for people who were having a lot of trouble managing their diabetes.
Right, like as a last resort.
Yeah. But now they're saying that, anyone with diabetes can benefit from using technology.
Interesting. So it's more about using technology proactively to improve health and well-being.
Right. And there are so many cool new devices out there now.
I know. It's amazing how far technology has come.
Yeah. They also talk about standardized reports for CGM devices, which is something that I think a lot of people have been waiting for.
Oh, yeah, that's huge. It'll make it so much easier to compare data across different brands.
Right. And then they're also recommending broader use of CGM, even for people who are not on insulin therapy.
Really? That's interesting.
Yeah, because it can provide a lot of valuable information about how your blood sugar is responding to different foods and activities.
Yeah, it's like having a window into your body.
Right. And then they also talk about insulin pumps and automated insulin delivery systems, including open source options.
Oh, wow, that's getting really advanced.
It is. But they do emphasize that, these are complex systems and it's important to work closely with your healthcare team to make sure that you're using them safely and effectively.
Right. Technology is great, but it's not a substitute for good medical care.
Exactly. Okay, so we've talked about food, exercise, and technology. Now let's move on to a topic that I know can be a little bit sensitive. Section 9, obesity and weight management.
Okay, this is a big one.
It is. And I think the standards do a really good job of acknowledging the complexities of this issue.
Yeah, they really highlight the importance of addressing weight stigma and bias.
Right, because it's not just about the number on the scale.
Exactly. It's about overall health and well-being.
Yeah. And they emphasize that weight management should be individualized and focused on what's best for the person, not on some arbitrary ideal.
Right. What works for one person might not work for another.
Exactly. They also talk about the importance of long-term support for weight maintenance.
Because it's not just about losing weight, it's about keeping it off.
Right. And they have a new recommendation for malnutrition screening, especially for people who have lost a significant amount of weight.
That's important. Sometimes weight loss can lead to nutrient deficiencies.
Right. They also provide updated tables on medication efficacy, side effects, and costs, which can be helpful for people who are considering weight loss medication.
Yeah, that's practical information.
Right. Okay, so we've covered a lot of ground in this section. We've talked about food, exercise, technology, and weight management, but we're not done yet.
Still more to come.
There is, there is. In the next part, we'll be diving into the world of medications.
Okay, bring on the pharmacology.
All right, welcome back to the final part of our deep dive into the 2025 Standards of Care in Diabetes.
We're in the home stretch now.
We are. And we've covered a lot of ground already,
We have.
but we've still got a lot more to talk about.
Yeah, there's some really important stuff in these last few sections.
There is. So let's jump right in with Section 10, Pharmacologic Approaches to Glycemic Treatment.
Okay, the meds.
The meds, yes. And I know this can be a really overwhelming topic for a lot of people.
Oh yeah, for sure.
There are so many different medications out there now.
It's a lot to keep track of.
It is. But I think the standards do a really good job of breaking it all down and making it easier to understand.
Yeah, they provide a lot of guidance.
They do. So one of the big changes in this section is the emphasis on personalized medicine.
Right, finding the right medication for the right person.
Exactly. It's not just about lowering A1C anymore.
No, it's about looking at the whole person.
Right. So they're recommending that you choose medications that address multiple treatment goals.
Okay, like what?
Well, for example, if you have cardiovascular disease, you might want to choose a medication that also helps protect your heart.
Right, so hitting multiple birds with one stone.
Exactly. They also have specific recommendations for people with heart failure, kidney disease, and fatty liver disease.
Okay, so really tailoring the treatment to the individual's needs.
Exactly. They also provide updated guidance on basal and prandial insulin with a focus on minimizing overbasalization.
Right, because too much basal insulin can lead to hypoglycemia.
Exactly. And they have a new subsection addressing medication shortages, which is something that I know a lot of people are dealing with right now.
Yeah, it's a real problem.
It is. So it's good that they're acknowledging that and providing some guidance on how to manage it.
Yeah, definitely helpful.
Okay, so we've talked about medications. Now let's move on to Section 11, cardiovascular disease and risk management.
Okay, heart health.
Heart health, yes. And we know that people with diabetes are at increased risk for heart disease.
Unfortunately, yes.
So this section is all about how to reduce that risk.
Okay, what are some of the key takeaways?
Well, they provide detailed recommendations on blood pressure monitoring and medication choices for hypertension.
So making sure your blood pressure is under control.
Exactly. They also have new algorithms for cholesterol-lowering therapy.
Algorithms. Like flowcharts?
Yeah, kind of. They're visual aids that help you decide which medication is right for you based on your risk factors.
Oh, that's cool. I like visuals. They make things easier to understand.
They do. They also emphasize the importance of screening for peripheral artery disease.
PAD.
Right. And they provide guidance on managing heart failure in people with diabetes and obesity.
Okay, so really comprehensive recommendations for cardiovascular health.
They are. All right, moving on to Section 12, microvascular complications and foot care.
Okay, so we're talking about eyes, nerves, and feet now.
Exactly. And again, we know that people with diabetes are at increased risk for these complications.
Yeah, it's one of the things that makes diabetes so challenging to manage.
It is. So this section provides guidance on how to prevent and manage these complications.
Okay, give me the highlights.
Well, they talked about specific eye exam frequency, especially if you have retinopathy.
Right, catching things early is key.
Exactly. They've expanded the criteria for screening autonomic neuropathy.
Autonomic neuropathy. That's the one that affects your nerves, right?
Right, the nerves that control your internal organs.
Yeah, okay.
And they have an important update on pain management.
Oh yeah, what's that?
They're now recommending against using opioids for neuropathic pain.
Wow, that's a big change.
It is. But there's a lot of concern about the risks of opioids, so they're recommending other pain management strategies instead.
Okay, that makes sense.
Yeah. And then they also have a new recommendation on smoke cessation in people with foot complications.
So if you smoke and you have diabetes, you really need to quit.
You do, you do. It can make your foot problems a lot worse.
Yeah, that's scary.
It is. It is. All right, so those are some of the highlights from section 12.
Okay, we're getting close to the end now.
We are, we are. So let's move on to section 13, older adults.
Okay, a special focus on seniors.
Yeah, because older adults have some unique needs when it comes to diabetes management.
Right, they might have other health conditions or be on multiple medications.
Exactly. So this section introduces a new framework for age-friendly care.
Oh, interesting. What's it called?
It's called the 4Ms framework.
4Ms. Okay. Well, what are they?
So the 4Ms stand for mentation, medications, mobility, and what matters most.
Okay, that's pretty easy to remember.
It is. And it's really about taking a holistic approach to care, considering all of these factors when you're making decisions about treatment.
So not just focusing on blood sugar numbers, but looking at the whole person.
Exactly. They also talk about individualized A1C goals for older adults.
Right, because what's appropriate for a younger person might not be appropriate for someone in their 80s.
Exactly. And they actually recommend considering CGM use for older adults.
Really? I thought CGM was mostly for younger people.
It used to be, but they're finding that it can be really helpful for older adults as well, especially those who are at risk for hypoglycemia.
Okay, makes sense.
Yeah. Okay, so that's a quick overview of section 13. Now let's move on to section 14, children and adolescents.
Okay, the younger generation.
Yes. And this is such an important time to establish healthy habits.
Absolutely. These are the years that set the foundation for lifelong health.
They are. They are. So this section really focuses on education and support for kids and teens with diabetes.
Okay. What are some of the key recommendations?
Well, they talk about the importance of involving the whole family in diabetes management.
Right, because kids need support from their parents and caregivers.
They do. They do. They also emphasize the importance of healthy nutrition and limiting sedentary behavior.
So cutting back on screen time and getting kids moving.
Exactly. They provide age-specific A1C targets.
Okay, because those are different for kids than they are for adults.
Right. And they have updated guidance on insulin pumps, statin therapy, and managing obesity in this age group.
So a lot of really important information for parents and caregivers of kids with diabetes.
There is. There is. Okay, moving on to section 15, management of diabetes in pregnancy.
Oh, this is a big one.
It is. It is. And this section has been completely restructured this year.
Really? What's different?
Well, they've now combined all types of diabetes in pregnancy into one section.
So type 1, type 2, and gestational diabetes are all together now.
They are. They are. And they've streamlined the recommendations, making them easier to follow.
Okay, that's good. It can be confusing trying to figure out which recommendations apply to you.
Right. They also provide more specific guidance on CGM use, glucose goals, nutrition, and insulin delivery during pregnancy.
So really helpful information for women who are pregnant or planning to become pregnant.
It is. It is. Okay, now let's talk about section 16, diabetes care in the hospital.
Okay, inpatient management.
Right. And this is an area where things can get really tricky.
Yeah, it can be hard to manage your diabetes when you're in the hospital.
It can. It can. So this section emphasizes the importance of communication between your diabetes care team and the hospital staff.
Right, because you want to make sure everyone's on the same page.
Exactly. They provide specific recommendations for identifying and treating dysglycemia in the hospital.
So making sure your blood sugar stays in a safe range.
Right. They also talk about the importance of continuing your personal diabetes devices if possible.
Like your insulin pump or CGM.
Right. And they have new recommendations for managing DKA and HHS.
DKA and HHS, those are serious complications.
They are. They are. So it's important to have clear guidelines on how to manage them.
Definitely.
Okay, so we're almost done here. Just one more section to go.
We're in the final stretch.
We are. We are. So section 17 is all about diabetes advocacy.
Okay, standing up for your rights.
Exactly. And this section is all about empowering people with diabetes to advocate for themselves and for the diabetes community.
Okay. What are some of the key takeaways?
Well, they provide updated information on diabetes care in schools and driving regulations.
So practical stuff that people need to know.
Right. And they have a new subsection addressing diabetes management in detention facilities.
Oh, wow, that's important.
It is. It is. Because people with diabetes deserve to have access to quality care no matter where they are.
Absolutely.
So those are just some of the highlights from the 2025 Standards of Care in Diabetes.
Wow, we covered a lot of ground.
We did. But I hope this deep dive has been helpful.
I think it has. It's a lot to take in, but it's really important information.
It is. It is. And remember, these standards are really just a starting point.
Right. It's up to each individual to work with their healthcare team to develop a personalized plan.
Exactly. And I encourage everyone to check out the full standards document for all the details.
Yeah, there's a lot of great information in there.
There is. There is. So thank you for joining us on this deep dive.
It's been a pleasure.
And until next time, stay informed, stay engaged, and keep on advocating for your health.